Oh, a little nervous. Sorry, let me catch my breath. Sweating a lot here, sorry. Have you guys ever experienced increased perspiration, increased heart rate, heavy breathing when you're in front of a group of people? Well, I know I do. Charles Poole actually stated over half the population is affected by speech anxiety, and it's detrimental to some. A personal example of mine is in my Latin class. I was told to come up to the front of the class to recite a Latin phrase, and on my way up to the front of the class, I got so nervous. I was sweating, my face was beat red. By the time I got up there, I was breathing like I just got done running. I hurried up and got back to my seat because I was terrified. It's really embarrassing, and it's one of the reasons why I've been putting off this class. What I want to go over is the symptoms of speech anxiety, why we are affected by it, who is affected by it, and ways to overcome the fear. First, the symptoms can actually be quite debilitating and embarrassing, as we can see here. And we have a few symptoms. We have verbal and nonverbal symptoms of speech anxiety. The nonverbal symptoms are acute hearing, increased heart rate, increased blood pressure, dilated pupils, increased perspiration, increased oxygen intake, suffering of the back and neck, dry mouth, and a few verbal symptoms are tense and quivering voice, repetition of ums, and filler words. Those are a few of the embarrassing symptoms, and let's talk about reasons why we are affected by speech anxiety. One reason could be that when we were younger, we were in front of people giving a speech or talking about something, and something embarrassing happened. And then we've been pushing it off, and as you push it off, it builds the fear in public speaking. Another reason is because you want to excel, you want to do really good, and you get terrified, and your mind starts going in overdrive, thinking about, am I going to mess up? What if I forget what I'm going to say when I get up there? And that ends up making you nervous, and that builds the fear. The third thing is peer evaluation. When you're up there, you're worried about who's judging you. You're worried about, can they tell that I'm nervous? You get yourself so worried, and that's going to also build your fear. So now that we know what speech anxiety is and some causes of it, let's talk about how common it actually is. Over 75% of the population is affected by speech anxiety. It's actually 3 to 4 out of the people in the classroom who are affected by this. I know a quote by Professor Rosenthal. He states that speech anxiety is feared more than death itself. He states that professional men, speech anxiety is number 1 of their fears, and for women it's number 3, and death is number 6. And another quote I know of Jerry Seinfeld, which kind of relates to this, is at a funeral, most people would rather be in the casket than giving the eulogy, which kind of is how some people feel. Now that we know how common it is, let's talk about how to overcome the fear. And it's not going to be picturing your audience naked. It just doesn't work. It's practice, practice, practice. You need to practice your speech to become confident, because confidence is what is going to overcome your fear. I have actually been reading at my church recently to kind of overcome the fear of talking in front of people. And that helps me a little bit. I know you need to continue practicing. And so you also need to know your topic. If you know what you're talking about, you're going to show your confidence, and your audience is going to see that. Also, your audience is going to understand your speech anxiety, so you don't have to worry about if they notice how scared you are, because they've been there, they've done that, and they're not judging you on that. So now that we've talked about the causes, the symptoms, the causes, the commonality, and how to overcome the fear, you can take this presentation and use it to build your confidence for your future speeches. And just remember, don't use picturing your audience as a strategy. It's not a successful one. All you need to do is practice.